Former President Joe Biden announced that he'd been diagnosed with prostate cancer. This news reminds us that prostate cancer is one of the most common cancers among men, with thousands diagnosed each year. And while a diagnosis can be overwhelming, early detection and advances in treatment have improved outcomes for many patients. To help us understand more about the warning signs, treatment options, and how to have challenging conversations, we joined by family medicine physician Dr. Thaddeus Bell. Dr. Bell, thank you so much for being in the studio with us.
Thank you very much for having me.
We talk about prostate cancer, and this is something that sometimes people are unsure about, maybe the warning signs of prostate cancer. Can you talk about what this disease means and who is most often affected by prostate cancer?
Well, the thing that makes prostate cancer such a dangerous cancer is because oftentimes there are no signs or symptoms. And so that is one of the main reasons why at least I, along with some other doctors, began to check men at age 40 whether they are having symptoms or not. The average patient is not going to come in and say, check me for my prostate. That's just not going to happen. So we do know that prostate cancer is the #1 cancer among black as well as white men. And so I don't wait and ask them whether they want me to check it. I just routinely check it. And the results have been interesting.
Yeah, so you say 40. We are hearing this story, of course, about the former president at his, age 82, I believe,
right,
that this was a recent diagnosis for him. What is the recommended age then?
Considering the president's age, the guidelines currently state that at around age 75, you stop checking, okay? There is a principle called shared decision making. That's when you come in and you and I discuss it, and we make a shared decision that it should be checked. I don't use shared decision making. I just say, look, we're going to check starting at age 40, and we are going to go forward. The interesting thing about the president is that because he's the most powerful man in the world, you would have thought that they would have started checking him regardless of his age.
What are some of the different treatment options, Dr. Bell, for someone who has heard this diagnosis?
Well, the treatment options vary from patient to patient. It can be chemotherapy, it can be surgery. Robotic surgery is the one that's most, that a lot of young men are deciding to have. And it can be radiation therapy, or it can be hormone treatment. I'm a prostate cancer survivor, so I underwent hormone treatment.
Dr. Bell, is there a genetic component with prostate cancer, and who are those patients who should be checked perhaps earlier than others? And you said that sometimes there are no warning signs, but can there be warning signs?
There can be warning signs. The warning signs can be anything from getting up at night, going to the bathroom a lot, or not being able to have an erection when it's time to have one, or having blood in your urine. But most of the time, in my practice, we make the diagnosis with the PSA, which I do annually, and most of the time patients don't have any idea that they have it.
One final question. This can be a challenging conversation for someone to have with their doctor and with their families. What are your guidelines and recommendations?
Well, this is where trust with your primary care doctor. Most of the time, when men come in and talk to me, we already have a relationship. And so if men are going to talk to you about their sexual health, they got to trust you in order to be able to do that. And I think that that's why I've been pretty successful in making the diagnosis early with a lot of my patients, because I have a relationship with them, and they know that I have their best interests at heart. And so I tell them, look, we're going to check for this. By the way, the other thing is, yes, it does run in families. However, it doesn't have to. And lots of times, for a lot of men don't know their family history. And so if we find it, we encourage them to find out.
All right, Dr. Bell, always closing the gap when it comes to having difficult conversations in terms of medical diagnoses and disparities in health. Thank you so much again for your time. We appreciate it. If you would like to find out more about Dr. Bell's work, he's been around for a really long time. I say that in the kindest way, Dr. Bell.
No problem.
There's a QR code that's on the screen if you would like to find out more about closing the gap in healthcare. We want you to stay right here with us. We are coming right back with more News 2 at 4 after a quick break.